My name is Nick Mayfield. I am from Jackson, Mississippi. I trained at the University of Mississippi Medical Center. I also completed my internship and residency there. I then went to Houston, Texas to Retina and Vitreous of Texas to complete a retina fellowship. I started here in 2008. So most of the time people are here to see me with a bad visual problem. They're uncomfortable and they're nervous. They're not real happy to see me. So my first line almost always when somebody comes into my office is, "I'm sorry that you have to come see me." And usually that at least puts them in the right frame of mind, and then we can move on from there. But I love the fact that you can have a problem in ophthalmology. It's usually easily identifiable, and usually there's a solution. There are some specialties where there's really no end to the treatment. I enjoy the fact that with ophthalmology and with retina in particular, there's a problem and I can fix it and usually make somebody better. I love the fact that I see so many of these patients for a long time. I see patients now that I started seeing in 2008. We've been through a lot of difficult changes with their vision, and most of the time they end up doing well. That's really rewarding. I get to learn about their families and hear about what they do in their spare time, and that's fun. One of the first patients I saw when I moved here had a serious problem with her eye, and her vision was down to the level of legal blindness. And she had been told that nothing could be done, and I think she came in pretty resigned that we couldn't help her. So as it turns out, she had something that we could help. I treated her several times, and now she sees well enough to drive and read and watch her children. And she's one of the happiest patients I've ever met. It's very rewarding to see her every time in the office. So the people who influenced me to go into ophthalmology were first my father, who was an ophthalmologist and practiced for many years in my hometown of Jackson, Mississippi. I was able to watch him as his career went by, and he had a good time seeing patients and worked very hard, but he was always there to go to my events and to be a part of my life. And that meant a lot to me and made my decision pretty easy. And I guess the second person is my mentor in residency, Dr. Chin in Jackson, Mississippi. He was our program chairman as a resident, and I watched him do retina surgery one time, and I was hooked. I knew then that not only would I do ophthalmology, but I would definitely try for retina.